Okay, now I'm going to show you how to set up a sterile tray. Make sure you wash your hands before and after every piercing. Okay. Alright. It's a good idea to have all your materials out, laying on the counter. I've got all my clamps and things in here. All my jewelry is here. All my needles are there. I'm going to set up for just a simple navel piercing and show you how it's done. Make sure your tops are loose, so you only need one hand to open them. Okay? And you can do that with your hand. You don't have to be gloved up when you're doing that. Okay? First thing I'm going to do is put on some gloves. Okay? Now you got to understand that this is not a sterile procedure. Okay? If it was, this would have to be sterile and my gloves would have to be sterile. What we are doing is using sterile technique. We do shiny side up on the dental bits. Okay? Now we have a clean hand and a dirty hand. Okay? What I want to do is, now this is dirty. I want to get the amount of cotton balls that I need to clean the client. Okay? Just in case I need one of these, I'm just showing you how you reach in here. Still clean hand, reached in. Nothing is cross-contaminated. Okay? I'm going to open this, and this is my Gentine Violet. This is what I use to mark the client, patient. Okay? Now I need a rubber band for this particular one. Still have a clean hand here. Okay, now I've got everything I need with my clean hand. Now I can touch this, because the outsides of these packets are dirty. You cannot drop them on here. You can only open them up and drop them on the tray. Okay? This is how you do not cross-contaminate. Drop it on the tray. I've got the jewelry here. I'm going to open that up. Okay? And drop that on the tray. Okay? Now I'm going to open up the needle without touching it. Drop it on the tray. Okay? Now I have my tray set up. Now I can start cleaning. So I'm going to put my stuff to clean them with. Okay? Now I'm going to clean the client and just believe that I did that. Every time you use a cotton ball to clean your client, you must drop it into the trash can. You cannot put it back on this tray. Then the tray is cross-contaminated. So I use one or two or three to get the client nice and clean. I drop them in there. Now I need a Q-tip. I'm going to clean really deep inside the navel, and then I'm going to get rid of that too. Now I can touch the sterile equipment, but I must change my gloves first, because these now are dirty. Okay, so I get rid of these gloves. I get a new pair of gloves. Every piercing gets 2 pairs of gloves. That's a lot of gloves. It's not cheap. Okay. Now I've got my new gloves on. Nothing else has been touched. Now I can touch the sterilized equipment and set my tray up for the piercing. Okay. I'm going to put my rubber band around here, my clamp for the navel. Okay. I'm going to get my jewelry ready for insertion. Okay. Now, the toothpick, I forgot to go over that. With my dirty gloves, backtrack, I dip it in my Gentine Violet. I have the client stand up and I make my marks on their belly button perfectly straight up and down. Get rid of that. Okay, now I can touch it. Okay, so now I can do my piercing. You saw how a perfect non-cross-contaminated tray is supposed to be set up.